Assalamu alaikum. Assalamu alaikum. Okay, students, so I welcome you all to another lecture in our series of lectures on anatomy. And we finished the lymphatic system yesterday. Today we're going to start joints. Now, I wanted to talk to you about a few things. I hope that all of you are following everything that we're studying. Uh, you are revising these things from a book or something. If you're not doing that, then I'd advise you to please open your books and start studying your books. Okay, because a textbook cannot be replaced. Like these PPTs, they are not a replacement of your textbooks. The things which are written in your textbooks, those are the things that you need to remember. So there are some things that I explain in more detail. There are some details that I missed during the lecture. So all of these things, they are included in your textbooks. So please make sure to read your textbooks after watching the lecture. So these joints and the musculoskeletal system, this we've already studied. The first batch that came, there were about 25 to 30 students. We've already studied these things, and now we're going to just uh, take a quick review of these things. After this, we'll be starting a very complicated and a very important system, that is the nervous system. So we'll be studying the central nervous system and the peripheral nervous system, and then we'll be going into details of the musculoskeletal muscles, and then we'll be studying the uh, regional anatomy as well. Regional anatomy mostly includes the musculoskeletal system, the upper lower limbs, etc. Abdominal region and everything else we've studied in the systemic anatomy. So about that, we'll only study the surgical anatomy of the abdominal system, etc. So let's start today's topic, that is the joints. And from the next week onwards, I need you to be more attentive. I need you to open your books and start neuroanatomy with me. Okay, so joints. So what do you think, what are joints? When you hear this word, what comes into your mind? You think like it should be, it must be a junction where two bones attach, etc. So the thing is true to some extent, but if we go into the definition of the joints, it is a junction either between bones or bones and cartilage. So between two or more than two bones, or between a bone and a cartilage or multiple cartilages in a bone, there is a junction which is known as joint. The basic principle of the joint is that it permits movement of the attached bones or the attached adnexa. If we do not have joints, the bones are conjoined together head to head, then we would not be able to move either of the uh, bone, as happens in many diseases. For example, when the joints are inflamed in septic arthritis or rheumatoid arthritis, they get stiffened. They are not stiff like a bone, but they are somehow stiffer as compared to the normal joint, and movement is uh, restricted to very much extent at that point. So if you want to move a joint which is inflamed, it is very painful process. The patient would not be able to stand if he or she has rheumatoid arthritis in the knee joint, popliteal, right? So we can get the scenario that these are very important for the movement of the body. The study of the joints is known as arthrology. Okay, arthur, wherever arthr comes, remember that we are talking about joint. If it is arthritis, then it is inflammation of joint. Arthrology, the study of joints. So I hope you get the sense of this word. So if we want to classify joints, we classify them on two different bases. The first classification is structural, whereas the second classification is functional. Structural classification is according to the morphology of the joint. What tissue makes the joint? What are the components that are present in that joint? That has a structural classification. So fibrous joints, cartilaginous joints, synovial joints. These are three subdivisions if we want to classify the joints on their structural basis. What are these? We'll go into details one by one in the next slides. And we can also classify the joints on the basis of their function, or on the basis of their degree of mobility. How much motion, how much movement of the attached structures do they allow? There are some joints that are completely immobile or immovable. These joints are known as synarthrosis joints. Okay, so synarthrosis, this word, whenever it comes, it means those joints which cannot move, where the attached bones or bone and the cartilage cannot move at all. That would be synarthrosis. Amphiarthrosis joints are slightly movable, whereas diarthrosis joints are those joints which allow a range of movement. An example is the synovial joint. So we'll study these two one by one, or I'll keep telling you which one is synarthrosis, which one is amphiarthrosis, and which one is diarthrosis. So this was a brief introduction. Now let's continue on. First, the fibrous joint. Fibrous joints are also known as synarthrosis joints. So synarthrosis, as we know, they won't allow any movement. They are fixed joints at which there is no movement. No movement is allowed at all. And if there is movement, then there must be some pathology, there must be some disease, because we cannot afford movement at these joints. They are basically structural joints that would keep structure intact, or they would keep an essential organ protected at its place. They maintain the body structure. Basically all joints maintain the body structure, but these joints are very important. The articular surface is a surface which is involved in making the joint, such as if we talk about, let's suppose, this joint. These are the articular surfaces which are being involved in making the joint. So the articular surfaces are joined by tough fibrous tissue. Examples are sutures, gomphoses, and syndesmosis joints. So what is a fibrous tissue? You must know by now what is a fibrous tissue. Fibrous tissue is wherever there is increased presence of a protein that is known as fibrin or fibrinogen, precursor to fibrin, at that place, at that tissue. Fibrin is present in scar tissue. So have you seen a scar tissue, जिसे हम खरिंड कहते हैं उर्दू में या पंजाबी में, ठीक है? That forms over a damaged epithelium or over the damaged parts in our body. That scar tissue just looks like a layer of dead cells, and it is very tough in nature, and it is very tightly bound, and it cannot be moved at all. So let's talk about now these examples of the fibrous joints or syndesmosis joints. So the first example was the sutures. The sutures are obviously immovable fibrous joints, and these sutures bind the skull bones together. So you can see here, these are the sutures. Some in the longitudinal plane, some in the vertical plane, and this is a close photo. As you can see, these are the bones, and in between the bones, this bluish colored thing, these are fibrous uh, tissue which is binding this joint together. They would have either overlapping beveled edges such as sutures, or plain and straight non-overlapping edges such as the palatine process of the maxilla. uh, I'll find your photo and send it in the group. You can look there. You can see here there are ragged edges which are overlapping each other in sutures, whereas in the maxilla it is straighter and plainer, but still it is joined by immovable fibrous joint. So why are these sutures so important? So there are, I think, 8 bones that make up the cranial region. These bones must be held tightly in place to protect the brain, to protect the cavity, to make a cavity that could house the brain and protect the brain in its place. These should be so strong that even if a blow uh, hits the head, if we hit the head or give a blow to the head by some hard surface, for example, if we fall from a bike or a car or anything, or we get hit with a bottle, they must not move from their place so as to protect the inner structures. That is why these sutures are being made so strong. Now, a question may arise. Some of you may have a question that if we look at the head of a neonate, of a newborn baby, it is smaller in size, whereas the head of a adult person is larger in size. How does that occur? So the answer to that is, when a newborn comes to the world, these sutures have not been established completely. There are uh, some fossas which are present in these sutures, and they fuse when the baby progresses in age. They fuse together. Some of these would fuse in the first few months, whereas the others would take up to a year or 2 years to fuse together, and the bones would continue to grow on, and the brain would continue to grow, get larger in size. But these sutures, they would be fused into their places, and they would keep the bones together at the place. So there's a societal norm in Pakistan where you see our grandmothers, etc., they try to mold our head. They say that the head of this newborn is not up to the mark. इसका तो सर ही अजीब सा है, माथा छोटा सा है, और ये और वो है. And they try to mold that with their hands. They do that every day, or they give the children special pillows where they rest and their head gets flat from the back, and things like that. That could happen at that age because sutures have not fused yet, so they can mold this head to a certain degree. When they get fused, you may strike your head 1,000 times against a wall. It won't change its shape. The most damage that you can do is a skull fracture. Okay, the skull would fracture and then it would either heal or you'll die. Okay, so this is a possibility. This could happen, but you cannot change the shape of your head only by molding it with your hands or pressing it with your hands. But it is possible in a newborn. Why? Bones are softer, sutures have not yet fused, have not yet come into place. So that is why this happens. So let's proceed. Gomphosis. Gomphosis is a fibrous joint via which a tooth is attached to its socket. So this is a gomphosis joint. This is a socket and a tooth is attached here. This is a gomphosis joint. So as you can see, this tooth or all of our teeth are being held in place by gomphosis joints that are fibrous periodontal ligaments, which are made up of collagen fibers that attach the teeth to the jawbone. Slight degree of movement may occur while chewing, but it is not so considerable. Okay, why do we need such strong joint at our teeth? Because we cannot afford our teeth breaking down all the time. So when you chew on a hard thing, for example, you're trying to peel off the sugar cane, गन्ने से उसकी छिलका उतारने की उसका कोशिश कर रहे हैं, ठीक है, पेन स्टार्ट हो जाती है, टूथ स्टार्ट मूविंग, हम कहते हैं दांत कमजोर है, ठीक है. That is a issue with this joint. This has not yet matured or this has get weakened. These ligaments are weakened. That's why your teeth are moving. So these joints do not allow a wide range of movement. A very slight movement is possible while chewing, but if we hit the tooth with a hard object, the ligaments may get damaged, the tooth may come out, such as when we fall down or hit a hard object. A hard object hits our mouth, it may damage a tooth may fall out. That is the breakage of this joint. The third one is the syndesmosis. Now sometimes a joint is formed between two bones where these bones are only held together by some ligaments. Normally what would happen is when humerus is making a joint with radius ulna, there would be a synovial membrane, there would be cartilage covering both ends, there would be synovial capsule that would enclose all of this material inside, and hence a synovial joint would occur. So in between the bones or in between the cartilage, there are many prerequisites that would be present. But sometimes in between the bones, there is only a thin layer of ligaments. Not thin, but a layer of ligaments that is present. These joints are lined by a membrane of collagen fibers that is known as interosseous, interosseous membrane, a membrane that is present between the two bones. Osseous means bones, inter means between. So interosseous membrane is present between the two bones. These allow movement to some extent, to some degree, rotational kind of movement. And these joints are present at two sites in the body, that is between the radius and the ulna longitudinally, as well as between the tibia and the fibula in the legs longitudinally. So interosseous membrane is a joint, in fact, which is fibrous in nature, and it is known as syndesmosis. So you must remember this thing. Alright, So this is a magnified picture of this joint. So sutures are present in the skull cavity, form forces between the teeth and the socket, and syndesmosis is present between the radius ulna and the tibia fibula. Now remember, this joint is not syndesmosis. This would be included in the synovial cavity. This joint is syndesmosis joint. Alright. Now let's talk about the cartilaginous joint or synchondrosis. Chondro word, whenever it comes, chondro means cartilage. Cis is related to joints mostly. So synchondrosis is a joint which is also known as primary cartilaginous joint. These joints are temporary because after a certain age the cartilaginous plate would be replaced by the bone, and then these joints would be known as synostosis. Osto means bone. So where are they present? They are present in the sternum, where the ribs they attach to the sternum, and in the epiphyseal plate in the children, between the epiphysis and the diaphysis. So in these joints, hyaline cartilage will be present between two bones. So two bones will be connected through a cartilaginous tissue. That is why it is known as synchondrosis. And when bone takes its place, it will be known as synostosis. If we look at the ribs are flat bones which are 12 in number on both sides, 24 in total, and they protect our chest cavity. Alright, so they will protect our chest where the lungs are housed, where the heart is housed, and all the major vessels are there. So they serve a very important function, that is to protect these vital organs, as well as they allow the movement of chest for the inhalation and exhalation of air. So we need a sturdy, strong, but to some extent flexible joint for these. That is provided by the cartilage. The type of cartilage that is present between these two is the hyaline cartilage. Remember this. Hyaline cartilage. Fibrocartilage is the tougher one, and that is present in the fibrous joints. Whereas hyaline cartilage allows some movement, whereas elastic cartilage allows the maximum movement. So sternum is also known as the breastbone. That is present in the middle of our chest cavity. This is the upper part of the sternum, that is known as the manubrium sterni. This is the xiphoid process or xiphisternum. Now throughout the sternum, it has places where the ribs can come and attach with it. In between the rib and the sternum, there won't be ligaments, there would be cartilage, which could be hyaline in nature. And the joint between the sternum and the ribs is known as a costochondral joint. Costo from the ribs and chondral from the cartilage. So costochondral joint is its name. Moreover, when children are growing, long bones of the children long bones contain three parts, as we've already discussed: the epiphysis, the diaphysis, and the metaphysis. So the diaphysis is the middle part, and the epiphysis is the outer part. In between the epiphysis and the diaphysis is a zone that is known as the epiphyseal plate. Epiphyseal plate is made up of cartilaginous tissue, hyaline cartilage to be exact. So this hyaline cartilage is the center of growth of the bone in children. When the children are growing, their height is increasing. That increase in height means the long bones, they also need to grow in size as well as in length. So the increase in length of the long bones is through that epiphyseal plate. When the children reach a certain age, they hit puberty and then they reach a certain age. For example, in the males, the age is about, I think, 17, 18 years. In females, it is about 16, 17 years. So at that age, those hyaline cartilage cells, or hyaline cartilage tissue, or the epiphyseal plate, it would be replaced by the normal bone tissue. And then these joints would be known as synostosis joints. Synostosis would occur and the bone would complete itself. There would be no more kind of breakage between the epiphysis and the diaphysis of the long bone. And the growth of the bone would stop. That is, the growth in length of the bone would stop. The bone would continue to grow in its breadth. It would keep getting broader and broader, especially in males, as they progress in age. Up until 25 years of age, the bone would start get broader in size. So this is how this thing works. Now let's talk about the last cartilaginous joint, that is the symphysis. In symphysis, the articular surfaces are covered by a thin layer of hyaline cartilage and united by a disc of fibrocartilage, such as the pubic symphysis, the manubriosternal joint, and the intervertebral discs. These joints are permanent and persist throughout the life, and only slight amount of movement is possible. So what happens is, as we can see here, this is present in between the vertebrae. These are known as the intervertebral discs. So what would happen here is, let's suppose this is the uh, second lumbar vertebra, this is the third lumbar vertebra. So there would be a thin layer of hyaline cartilage just under the second lumbar vertebra. Then there would be a disc of fibrocartilage, and then another thin layer of hyaline cartilage on the upper side of the third lumbar vertebra. So it is kind of, the disc of the fibrocartilage is kind of sandwiched in between two hyaline cartilage membranes, thin hyaline cartilage membranes. So this is how a intervertebral disc would look like. The same thing is present in the manubriosternal joint. Manubrium is this upper part of the sternum, a small coin-like, you can say, or pentagonal-like structure. Then there is the sternum. This is the sternal bone. In between this manubrium and this sternum is the same process. Two thin layers of hyaline cartilage on the outside and a disc of fibrocartilage in the middle. That's how this would be attached. And same would happen in the symphysis pubis, that is this joint. So in symphysis pubis, two hyaline cartilages on both sides, fibrocartilage in between. So due to presence of hyaline cartilage, some movement would be allowed, but due to presence of fibrocartilage, joint would be very sturdy, very strong. Why do we need this much strong joint? Because our vertebrae have to bear the weight of our whole body. They contain the spinal cord. They contain components of the central nervous system. So this, they must be well protected, as well as they should be kept in their place, so that no damage could occur to the spinal cord. Same is true for the manubriosternal joint. Uh, just behind the manubriosternal joint is the heart. If we get a strong blow to the front of our chest and this joint breaks, what would happen? Our chest would get flailed, like it would be depressed inside. The heart can get damaged, it can get lacerated, and we cannot afford that. Same is true for the pubic region. Bladder would be present just behind the pubic symphysis. Kidneys would be located above the bladder, or uh, sexual organs would be located there. So if we get hit at that point, we cannot afford any kind of damage to those vital structures, to those essential structures. So they need to be protected. But in the meantime, there should also be some movement. So, such as when we bend down, we can see our vertebra are allowing some range of movement. So that should be present. That is normal. Same when we breathe, there should be movement in manubrium sternum. When the female is delivering the baby, there should be some movement in the pubic symphysis region. So all of this, for this Allah Ta'ala has made our body like this, that it is a combination of both hyaline as well as the fibrocartilage. So there is some movement, but the joint is sturdy, joint is strong in its place. There is a condition which is known as I forgot the name, but bamboo spine. Bamboo spine, is its other name. I forgot the name. In that, or vertebra get stiff. The patient is not able to bend down. The patient is not able to move the vertebra. That is a very painful condition. Alright. So that is an autoimmune disease which is related to the crest syndrome. So I'll look about that. But the thing is, we should know that everything in our body is made this way because we need it this way, and everything is designed for its specific site and function in our body. So please try to get more and more knowledge about that. Please try to study that harder, so that you will understand the processes that are present in our body, the structures that are present in our body, and the beauty by which these structures are made. So I'll see you on Monday, inshallah, and I'm looking at the assignment. I'll let you know about the results on Monday, inshallah. Take care. If you have any questions, please post them in the group. I'll send this slide in the group too. Thank you. Take care. Allah Hafiz.